Welcome to the deep dive.
Yeah.
We are pulling back the curtain today on some information you really need to live better.
That's right.
And today, we're sinking our teeth into something absolutely fundamental. It's about your overall health, spotting the early signs of gum disease.
Periodontal disease, yeah.
Eh.
It sounds technical, but it's incredibly common.
And our sources, they really treat this seriously, not just, a minor thing. It's framed as a critical infection.
Potentially devastating, actually.
Right. If you ignore it, it can lead directly to losing bone, tissue, irreversible stuff. So our mission today is really to equip you, give you the knowledge to spot this silent threat before it really turns into a crisis.
Before it get out of hand.
Exactly. And hey, as we get into this, just a quick reminder, if you find this deep dive valuable, if it's giving you insights you can use.
Which we hope it is.
Absolutely. Please head over to Mind Expansion Daily. We're always putting out great information like this.
Yeah, definitely check it out.
So please like and subscribe while you're there. It really helps us out.
Okay, so setting the stage. The source material, it's crystal clear on this point. Gum health is never just a dental problem.
Right. It goes way beyond the mouth.
Way beyond. Periodontal disease, it's a major systemic threat. It's linked directly to really serious conditions. Think heart disease, diabetes.
Wow.
So catching it early, it's not just preferable, it's essential. Essential for reversing it before that damage spreads, throughout the body.
Okay, let's unpack that a bit. We hear gum disease all the time. And I think maybe for a lot of us, we picture it as, I don't know, something that only affects older people.
Yeah, that's a huge misconception.
Or maybe something that really hurts, so you definitely know if you had it.
And that assumption, that passivity, that's exactly why it's so widespread, according to the research. People think, oh, it must involve sharp pain.
Right, if it doesn't hurt, I must be fine.
Exactly. But the reality is, gum disease often progresses, well, silently. It starts very subtly.
No discomfort sometimes.
Sometimes none at all in those early stages. And it can hit adults of any age. That stealthiness, that's its main weapon.
The statistic on prevalence alone, that should really make us sit up and pay attention, shouldn't it?
Oh, absolutely. It's pretty staggering. The CDC, the Centers for Disease Control and Prevention, they say nearly half of all adults in the U.S. have some form of gum disease.
Half. That's incredible.
It is, and it confirms this isn't some rare thing. It's a massive, mostly silent epidemic.
And people just don't notice until it's serious.
Often, yes. Until, invasive treatments, costly treatments become the only real options left.
So, okay, if it starts silently, how does it actually work? How does the damage unfold step by step?
Well, it all kicks off with plaque. That sticky film of bacteria that's always forming on your teeth.
Right, the stuff you brush away, hopefully.
Hopefully, because if that plaque isn't removed thoroughly, the minerals in your saliva cause it to harden. It calcifies.
Into tartar. Calculus.
Exactly. And tartar, that's where the real trouble starts, because you can't just brush it away.
No way. It's like concrete on your teeth.
Pretty much. And just sits there irritating the gums. Plus, it provides this rough surface, like a perfect home for even more bacteria to latch onto.
Okay, so constant irritation.
Constant irritation. And that leads to the mildest form, the one you can reverse. It's called gingivitis.
Gingivitis. Heard of that.
Yeah. That stage is all about inflammation. You'll see redness, maybe swelling, and usually bleeding when you brush or floss.
That bleeding is the key early sign then.
It's a major one. But what happens if you ignore those signals? If you think, oh, it's just a little blood?
Then it gets worse, I assume.
It advances. It progresses to periodontitis, and this is much more serious.
Because it's not just the gums anymore.
Right. This is a severe infection that starts attacking the deeper structures, the ligaments, the actual bone, the connective tissue holding your teeth in place.
Oh, wow.
Yeah. Once periodontitis takes hold, you're looking at much tougher outcomes. Bone loss, your teeth getting loose.
And eventually maybe needing surgery or extractions.
Potentially, yes. Surgery, gum grafts, extractions. You really, really want to catch it before that structural damage kicks in.
Okay, the damage in the mouth is clear. But let's shift gears a bit, because you mentioned earlier, and the sources stress this. This isn't just a dental issue. What happens when those bacteria, leave the mouth? Why is this bigger than just teeth?
Well, think about it. The mouth is literally a gateway to the rest of your body, right?
Makes sense.
And the sources really emphasize these systemic links. It's about having this chronic, sort of low-grade infection simmering away in your gums.
So the bacteria get out?
The bacteria themselves and also the inflammatory byproducts they create, they can enter your bloodstream through those infected bleeding gums.
And circulate everywhere.
Exactly. They're circulating throughout your body.
Which brings us straight to that heart disease connection you mentioned.
It does. Those oral bacteria traveling through the bloodstream. Well, researchers strongly suggest they contribute to heart disease by promoting systemic inflammation, sort of body-wide inflammation, and potentially helping to narrow or clog blood vessels. Atherosclerosis.
So when your dentist tells you to get cleanings twice a year.
It's not just for a bright smile. It's effectively preventative maintenance for your cardiovascular system.
That's a powerful way to think about it.
Yeah.
It's maybe the cheapest cardiovascular prevention you're routinely ignoring.
That's a great insight, yeah. It reframes the whole thing.
Now, what about diabetes? I've heard conflicting things. Is it just that people with diabetes get more gum disease, or does gum disease make diabetes worse?
The sources are quite clear. It's a two-way street, a really damaging one.
Okay.
Having poor gum health, that active infection and inflammation, it makes it much harder for your body to control blood sugar levels. It adds to the body's overall inflammatory load.
So it destabilizes blood sugar.
It can, yes. And conversely, if you have diabetes, especially if it's not well controlled, that condition impairs your immune system.
Making you more vulnerable.
Much more susceptible to getting severe gum disease in the first place, and it also slows down healing. So they're locked in this really harmful feedback loop. Each one makes the other worse.
Wow. The cost of just waiting, of delaying action, it sounds immense. Physically, financially.
Absolutely.
So we need to empower people. Let's get really practical.
Yeah.
Talk about those crucial warning signs. What are the, say, 5 critical red flags everyone needs to watch for?
Okay, yeah. These are your body's signals. Recognizing them early. That's the difference between maybe just needing better brushing and flossing versus, surgery down the line.
Right. Red flag number 1.
Bleeding gums. This is often the earliest, most noticeable sign. It signals inflammation, plaque buildup.
And it's not normal, right? People think, oh, I just floss too hard.
That's a huge myth we need to bust.
Yeah.
Aggressive flossing doesn't cause healthy gums to bleed. Inflammation causes bleeding. If you see pink or red in the sink when you spit,
Pay attention.
pay attention. Your gums are telling you plaque is irritating them. Healthy gums just don't bleed, period.
Okay. Red flag number 2.
Swollen or red gums. Healthy gums should be pale pink and nice and firm. They fit snugly around the teeth.
Not puffy.
Not puffy. Redness, puffiness, any kind of swelling that's a clear visual sign of gingivitis. It means the tissue underneath is fighting bacteria and inflammation.
Got it. Red flag number 3. This one can be socially awkward. Persistent bad breath. Halitosis.
Yeah, and we're not talking about, morning breath or garlic breath.
Right, something that lingers.
Exactly. This persistent foul odor, it's often caused by the waste products from that huge colony of bacteria living in those inflamed gum pockets. Or sometimes it's the tartar buildup itself. Essentially, it's the smell of a chronic infection.
Ugh, okay. Red flag number 4 involves how the gums actually look around the teeth. Gum sensitivity or recession.
Right. This is when the gums start to physically pull away from the tooth. Recede.
Exposing the root.
Exposing the root surface. And those roots are much more sensitive than the enamel crown, so you might notice increased sensitivity to hot or cold things.
And that pulling away creates pockets.
Crucially, yes. That recession creates these little pockets between the gum and the tooth where bacteria can hide, protected from your toothbrush. It just accelerates the whole destructive process.
Makes sense. Okay, and the final one, red flag number 5. This sounds more serious. Changes in tooth alignment or bite.
Yeah, this usually signals that the disease has progressed pretty significantly into periodontitis.
So loose teeth.
If your teeth start feeling loose, even a little bit, or if you notice your bite changing, like how your top and bottom teeth meet when you close feels different somehow,
What does that mean?
it means there's likely serious bone loss happening underneath. The infection has weakened that supporting bone structure that holds the teeth firmly, allowing them to shift or feel unstable.
That's definitely a sign you can't ignore.
Absolutely not. That requires immediate dental attention.
Okay, so recognizing these signs is step 1. Step 2 is obviously taking action. Let's talk prevention first. What's the essential daily routine?
It really starts with being meticulous, consistent, brushing twice a day, minimum, soft bristled brush, and really pay attention to the gum line, right where the teeth meet the gums. That's where plaque loves to hang out.
Flossing, the thing everyone hates.
Yes, flossing daily is pretty much non-negotiable. It's the only way to get the plaque out from between the teeth where your brush can't reach.
What about mouthwash?
An antiseptic mouthwash can help reduce bacteria, sure, but remember the main thing is physically removing that plaque film. Brushing and flossing do the heavy lifting. A balanced diet, low in sugary foods and drinks, also helps starve the bacteria.
And even if you do all that perfectly at home, you still need professional care, right? Because of the tartar.
Precisely. You can't remove tartar yourself once it hardens. Regular dental checkups, usually twice a year, are essential.
What do they do that we can't?
Well, besides scraping off that tartar, the professional cleaning dentists have tools like little measuring probes.
Periodontal probes.
Yes, they can measure the depth of those pockets around your teeth. They can spot subtle recession or inflammation way before you'd notice any looseness or major changes. It's early detection.
Okay. Now, for someone listening who thinks, uh-oh, I might already have some of those early signs, the sources mention deep cleaning. What is scaling and root planing?
Right, scaling and root planing is basically a deep cleaning procedure done below the gum line. It's usually the first line of attack for periodontitis.
How does it work?
2 parts. Scaling is where they meticulously remove all the plaque and tartar, not just above the gum line like in a regular cleaning, but crucially from those pockets below the gum line.
Getting down to the root.
Exactly. And then root planing is vital. They smooth out the surface of the tooth root itself.
Why smooth it?
Because a smooth surface makes it much harder for new bacteria to stick and recolonize. And, importantly, it helps the gum tissue to heal and reattach properly to the clean root surface. That's key for reversing the disease process and shrinking those pockets.
Makes sense. We also have to touch on lifestyle factors, things that either help fight this or, well, make it much worse. Smoking is a big one mentioned.
Smoking is a huge risk factor. It's like a double whammy for your gums.
How so?
First, it weakens your immune system overall, making it harder for your body to fight off that initial gum infection.
Okay.
Second, and this is a really key kind of insidious point, nicotine constricts blood vessels. It reduces blood flow to the gums, so it can actually mask that early warning sign of bleeding gums. Smokers often have less bleeding, even with significant disease, because the blood flow is impaired.
Wow, so they might not realize how bad things are until it's really advanced?
Exactly. They miss the early alarm bell because the nicotine is suppressing it. Quitting smoking is one of the best things you can do for your gum health.
And what about stress? Does that play a role?
It absolutely can. We know chronic stress impacts the whole body, right? It tends to increase inflammation.
Cortisol levels and all that.
Right. Elevated cortisol can make inflammatory conditions worse everywhere, and that includes your gums. So finding ways to manage stress, whether it's exercise, mindfulness, whatever works for you, that's also an active defense for your gums.
This has been incredibly insightful, a really critical look at the sources. The main message seems so clear, doesn't it?
It really does. Nearly half of adults are dealing with this, often without knowing it, and the serious stuff starts silently.
So awareness is everything.
Awareness of those 5 key signs we talked about, the bleeding, the redness or swelling, the persistent bad breath, the recession or sensitivity, and any changes in tooth position. Knowing those lets you intercept it early.
At that reversible gingivitis stage, hopefully.
That's the goal. That knowledge gives you the power to act before it escalates to bone loss, tooth loss, and those wider systemic health risks we discussed.
So the final thought, the bigger picture here is taking care of these seemingly small signals from your mouth. It's not just vanity. It's not just about keeping your smile looking good.
No, not at all.
It's fundamentally about safeguarding your overall health, your longevity, reducing major risks to your heart, your blood sugar control. It's all connected. Don't ignore those early warnings.
Well said. Don't ignore them.
So, what do you think? Do you agree with this summary? Maybe disagree. We genuinely want to know. Challenge yourself. Leave a comment below. Let's get a discussion going.
Yeah, we'd love to hear your perspectives.
And also, we're really trying to grow this community worldwide. So if you could, just mention where you're listening from in your comment. It's fascinating for us to see our reach.
It really is.
Finally, if you found this deep dive helpful, if you appreciate us breaking down this kind of critical health info, please do like and subscribe to Mind Expansion Daily.
It helps others find this information too.
Absolutely. And check out the description. There's a link there if you'd like to buy us a coffee.
Yeah.
Any support helps us keep creating these deep dives.
We appreciate it.
Thank you so much for joining us today. We'll see you next time on The Deep Dive.